wellness revolution starts now.
Welcome to the show. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy, and I am joined by Elena Mango today. We are going to discuss a very hot topic of long COVID or long haul syndrome. So we are seeing this all the time, and I think that it is time that we finally address it. Yes. So really we want to discuss what some of the symptoms are, some of the products that we've really used to help patients find a lot of resolution in their symptoms, and let you know that you're not alone if you're experiencing these symptoms as well. So just to kind of recap what long COVID is, or to all come to one place, because I think there's a lot of information out there about it, is that COVID became a thing in 2020, right? And then what happened? We thought it was going to go away, and it didn't. So now we came up with a new name for it called long COVID. But also what's happened is that this persistence of symptoms of people that have either really actually been sick since 2020 or have been yo-yoing since 2020 and have been getting progressively worse symptoms, that's what we're referring to as long COVID. So it's a syndrome or a collection of symptoms that can persist for several months, which is the typical case, or even years on end, which is not uncommon. And it's actually estimated that at least 65 million people have been affected by long COVID. And I'm coming across a lot of people that are experiencing these symptoms that we're going to dive into. So it's a bit puzzling about why this happens, and quite frankly, we've all been learning together the last 4 years, and we have so much more information than we did 4 years ago, which is what we're going to talk about today. So let's go ahead and kind of, dive into some of the questions I know that you have that are common questions that we get from guests that come to us surrounding the whole idea of long COVID.
Right. So sometimes people don't even understand that a symptom is related to long haul, as we call it. So what are some of the symptoms that people should be looking for?
So typically people come in with a lot of lethargy and fatigue, and that seems pretty obvious because usually they can directly correlate that back to a COVID infection. And that is a little bit more of an obvious one. The brain fog, which a lot of people refer to as COVID brain, the forgetfulness. Wait, I knew that name, or I knew where I was going, or I got lost on the road on my way to work. Why is that happening? I forgot where I put my keys. Honestly, a lot of these are clinically what we would almost think of as early onset dementia, which is really scary if you're the person that's experiencing that. It's the forgetting how to balance a checkbook. It's where did I put my keys. It's forgetting the name. All those are fairly classic symptoms. So we really want to pay attention to that. But I wouldn't say it's anything to be scared of. It's something that we now know that we can get ahead of. Or if you've been diagnosed with long COVID, okay, then how do we, go back and get you your function back? So as far as the symptoms go, there's actually a lot. And I kind of just want to list them here because I don't want to miss any. And there are quite a few. So again, that fatigue, that prolonged malaise, headaches, generalized fatigue, sleep difficulties is a big one. Hair loss is huge. And interestingly, I don't know why, it's always the people with the thick hair that experience it the most. So smell disorder, we know that. Some people still have not recovered their smell, but we've had good success with some of our compounds with that. Decreased appetite, painful joints, trouble breathing, chest pain, that cognitive dysfunction. Again, that COVID brain that a lot of people refer to. So that list by no means is exhaustive, but I think it's important to point out how broad those symptoms can span with long COVID.
Okay, so I know that you and the Physicians Preference Pharmacy have been doing a lot of work on bringing in options of medications and compounded medications. So what are the options for these different symptoms?
So we have a whole list of compounds that have really helped people with these particular symptoms by themselves. But I do want to address something just for a second, because I've spent a lot of time talking about mast cell activation syndrome, and it's something that's not going away, which is why I think it should be a huge focus, and we should be opening up the conversation around that. Based on the conferences I've attended, the literature I'm seeing coming out, there is a major overlap between MCAS, which is mast cell activation syndrome, and COVID infection, or long COVID or long haul syndrome. So one of the reasons why is that the COVID infection itself, as we know, is associated with the spike proteins that are on the outside of the virus that we talk so much about. But what happens when we get that spikeopathy, or what happens when that spike protein actually attacks the body? It really hijacks a lot of the natural systems of how the body should be functioning, but it really has an effect on the mast cell. And the mast cell is a type of white blood cell that's an immune cell that is responsible for a lot of different functions in the body, but really it has one overarching question to answer, and it is, am I safe? And if it perceives any threat to the body, it goes haywire. So what I am experiencing with patients increasing week to week, month to month, is these people are showing up as extremely sensitive. They were fine before, but now they can't tolerate foods. Now they can't tolerate medications. Now they can't tolerate supplements. What's going on? How did this happen? Well, the immune system is completely feeling attacked from every direction. So I think that portion is really getting missed in the kind of the conventional space. And so I want to highlight that, because we can't ignore the immune system when we're actually talking about the treatment and how we actually help to address these symptoms and resolve those symptoms for these patients. The patient is an individual. They have a certain lifestyle that they're living. They have a certain type of treatment approach or, modalities that they're going to respond to. So it needs to be individualized. So when we've created these solutions for patients, they've been very individualized. And so that's kind of the backbone of what we have available. And I know we'll get into some of the actual compounds, but that's how we address somebody when we're trying to figure out actually how to give them symptom resolution.
And it sounds like that might be difficult to even diagnose, because it sounds to me like someone might think they have an allergy or some kind of allergic reaction. So how does someone dig deeper into that?
Well, first and foremost, please find yourself a physician that knows what they're dealing with. And number one red flag is if your doctor says, I don't know what this is, I can't help you, that, or it's all in your head, then you need to run as fast as you can in the other direction and find yourself someone who can. Because we see that all the time. And unfortunately, I don't like hearing that when absolutely there's something going wrong and you don't want to feel like you're crazy, because this is not all in your head, right?
Exactly.
It's really not. So it's important that we are looking at the approach to, again, that symptom resolution of, for one, getting the spike protein out of the body, because when it replicates and replicates and replicates, we get further problems and further symptoms that just continue and continue to show up. So until we get it out, we're going to continue to have that problem. Not to mention, it breaks down the immune system. It hijacks the mitochondrial function, which is really core to natural cellular function. And when the mitochondria are hijacked, we no longer make the amount of oxygen and water and energy and all of these things that are vital to life. So what's going to happen? We're going to feel like we want to lay in bed all day. And that's how a lot of people are feeling when they've been affected with the symptoms of long haul. And then also, we want to be sure to replenish what the person has become deficient in. So it's kind of like a deplete, replete thing, deplete of the spike protein, and then give this person back what they're deficient in. Because it's probably pretty likely that they've become deficient in hormones, sex hormones, thyroid hormones, that they're highly inflamed, right? It's not just one symptom we're dealing with. That's why it's called a syndrome. It's several symptoms added up together that are creating this blow up in the body.
Such a great key learning, because, if you've had COVID or if you've had COVID multiple times, it's that self-advocacy to just dig deeper in terms of what you're feeling. So let's get to the actual compounds. It does feel like we've been talking about this for a long time, and it feels like COVID was so long ago, but it is real and the symptoms are real. So what are the compounds that you are utilizing to address COVID or long haul syndrome?
Right. So first and foremost, interjecting early is crucial. If you think you have a COVID infection, or if you know you do, get ahead of it now. Do not waste your time. Be sure that you have compounds on hand for when you do get sick, because I guarantee you it's going to be on a Saturday when the pharmacy's closed and you don't want to run into that situation. You got to interject early. It's extremely important. If you've already surpassed that point and you have long haul syndrome, a lot of the options are still going to be the same. One of the staples for us has been compounded ivermectin. It has been an absolute blessing to provide this to patients who, for one, have not been able to find it for other resources. And one of the reasons why we love ivermectin so much is it's so extremely safe. It has been around for so long, and the side effects are minimal, if any. And I cannot tell you how many people that have been using this for early, COVID symptoms have not even had to go into the hospital,
Right.
have not had sustained symptoms. And then you have people on the other end of the spectrum who have not been utilizing that, have been in and out of the hospital, again, kind of yo-yoing with their symptoms. So one of the reasons why we really like compounded ivermectin, which it's an oral capsule that we compound, where the entire dose is put into one capsule for the patient, is because it's easy to take. You don't have to take a bunch of tablets. You don't have to do that. It's a customized dose for you. But it works as a great anti-inflammatory. It's usually used as a anti-parasitic medication. So interestingly, parasites, when they invade the body, really they wreak havoc on the body. But what is a bit interesting to me as we learn more and more and more about how safe and effective ivermectin is one of the reasons it's effective is it shares the COVID infection shares some pathophysiology or some common factors with parasite. Think about it. Both a virus and a parasite require a host to live, to attach, to replicate, to infect, and to take over. So if ivermectin can interject, then we've helped to save that patient from a lot of inflammation, pain, degradation of tissue, et cetera. So ivermectin has been an absolute wonder for so many of our patients.
And actually, if I'm correct, ivermectin is dosed based on someone's weight, right?
Yes.
So by you compounding that in one capsule for that convenience, it's easy to do, right?
Yes, yes. And that's going to change. So we do get a lot of questions about, well, can I just take the one dose, if I'm sick or if I'm just trying to keep myself healthy? It's going to change. So that definitely requires calculation by your pharmacist and your physician to be sure you're getting the right dose, because just like with anything, we want to be sure you're getting enough, but not too much. And that window is really crucial. So please don't take your family's ivermectin.
Right.
Please take your own prescription, because for one, it might be available to you, but you might not be getting enough. That's actually really important. So, yeah.
Okay. So what about the other compounds that you utilize?
Yeah, so we have some staples. You don't have to reinvent the wheel to be healthy. Vitamin D is a huge one. So we know that vitamin D is very essential, not just for life, but also to help maintain a healthy immune system and also regulate our inflammatory response. So although there has not been a direct correlation in showing that a lack of vitamin D causes COVID, what we do know is that in a lot of autoimmune conditions, diabetes, cardiovascular disease, COVID infection, is that then when we evaluate the patient, those patients are always deficient in vitamin D. So it might not be totally a causal relationship, but there is some sort of relationship there that we can draw the parallel between. So by replenishing vitamin D levels, we're protecting the immune system. We're controlling inflammation. Again, you don't have to get fancy with it. Vitamin D is super easy to take. You can take it in a capsule. Sometimes it'll be dosed once every 10 days. We even have a topical cream. So again, if someone doesn't have a healthy gut and they can't absorb the way that we want them to by giving them an oral capsule, they can apply the vitamin D cream topically every day and still get it into the bloodstream for ample effect.
And when I think of vitamin D, I think of going to a vitamin store and taking vitamin D, but you're talking about a pharmacy grade vitamin D, correct?
Correct.
Okay.
Yes.
Which is a higher dose?
It is a higher
Okay.
dose, and what we find is that there are a lot of people, and I'm actually one of these people that first tried the over-the-counter vitamin D, and my levels never were sufficient. So some people just need that extra boost. They need that pharmaceutical grade and dose of vitamin D. And then also the route of administration is really important. So can you take it orally? Do you need it topically? It has to depend on the patient specifically. That's really important. some people don't do a great job of converting over to the active form of vitamin D. So we also have to make sure they're getting the right form. Gotcha. So most people tolerate oral perfectly. It's very inexpensive. Again, you want to be able to use several compounds together so that you're hitting this syndrome from several different angles without breaking the bank, right? So you want to be sure that each compound that is chosen doesn't just have one effect, but that each compound that's chosen has multiple effects. That way you don't end up on 100 things. Maybe you need 4 or 5, right? Something like that. Mm-hmm. Yeah. Another one, too, that we use a lot of is low-dose naltrexone. And we talk about this a lot in our practice, the use of LDN, which is low-dose naltrexone. And it's phenomenal for balancing out the function of the immune system. However, something that's interesting about low-dose naltrexone is that in a very large patient-reported study by the React-19 organization, who has looked at long-term effects on people who have been infected with COVID and reported their COVID infections, is there were a lot of different parameters that were looked at. It was everything from spiritual, like prayer or meditation, or over-the-counter supplements and over-the-counter medications, prescription medications, right? They wanted to look at the whole gamut, which is very interesting of what's really working for people as far as patient-reported symptom resolution of long-haul COVID symptoms. And the prescribed medication that beat out every other pharmaceutical drug, every other compound, was low-dose naltrexone.
Wow.
And again, whenever we can pull out one specific compound that can do a ton of different things, let's do it. And again, it doesn't have to break the bank, right? That's the beautiful thing about it too, is that low-dose naltrexone does a couple things in particular that are spectacular. It's a mast cell stabilizer. So we talked about the overlap between mast cell activation syndrome, or those mast cells, which are the immune cells, and how they go haywire. It's like if there's no signal shutting them down, they're going to keep reacting and reacting and reacting. And so the low-dose naltrexone says, it's okay, calm down, we got this infection, we're going to balance the immune system. It's also a great anti-inflammatory as well. And all disease is inflammatory driven, so we have a 1-2 punch there. It does a lot of other things as well. But because it helps to stabilize the mast cells, it's very effective for addressing that COVID brain, or that brain fog that's associated with long-haul COVID syndrome, because one of the main drivers and causes of that persistent brain fog is mast cell overactivation. And I think instead of giving people antidepressants and all these drugs to mask the symptoms of that, give them thyroid, give them a little naltrexone, help to stabilize the mast cells and the immune system, and the body will calm itself down. It knows how to do that. We just have to cue it up sometimes of how.
So much that you can do naturally rather than
Absolutely.
taking other avenues.
Absolutely. Absolutely. And then you can't go without recognizing that the thyroid is extremely important. So for patients that have hypothyroidism, a lot of times they will have that brain fog as well. They get that afternoon lull. They get that dip in energy. So I like to remind both patients and providers to recheck the thyroid labs and recheck the thyroid function after a COVID infection. The body's requirements of thyroid hormone can frequently change, especially following any significant event. Like when a woman has a baby, for example, the baby takes a lot of that thyroid. It creates a change in the body. There's been a physiological change after a COVID infection. So it's very likely that some of these symptoms like hair loss, fatigue are related to now this patient's been launched into hypothyroidism when they didn't have hypothyroidism before, because their thyroid hormone, their thyroid gland has kind of been hijacked. So everything that they're experiencing seems to be in alignment with what we would see in a hypothyroid patient.
And in that case, where their symptoms are mirroring hypothyroidism, but it's associated with long-haul syndrome, is that something that's temporary, or could that last longer?
That's an excellent question. And I would say that hopefully that it is temporary, because there is a root cause to what happened. now we have to remember that there was a threat to the body by the infection. So if we can remove that threat, which the persisting threat is actually the lingering of the spike protein. I mean, it's very disturbing if you think about it, that as far as I know, that spike protein can last up to about 6 months in the gut after an infection. I mean, think about that.
Right, it's a long time.
It's a long time, and no one wants to think about that just lingering in the gut. So we got to get it out. So once we get the spike out, then the body can learn how to recover. So I don't see why someone could not make a full recovery from that. It's a great question.
All right. What else?
Yes, I do have 2 more I want to talk about. One that it cannot go unrecognized and is a huge hero in the space of long haul syndrome is methylene blue. So methylene blue and red light therapy in particular, when used together, is referred to as photobiomodulation. And what that means is that you're giving compound orally, which is the methylene blue, because we compound that in an oral capsule. And then you're using a modality like red light therapy, which they have red light therapy beds that kind of look like a tanning bed, or they have these upright sitting panels that you can stand in front of that helps to drive the compound actually into the cell so that it gets absorbed at a cellular level. Now you've got something physically driving it in and doing its job there. But what methylene blue does is something very specific in long haul syndrome patients. Long haul syndrome patients, again, are experiencing the side effects of their mitochondria being completely hijacked. The mitochondria is the powerhouse of the cell. It creates the energy and it does a lot of other things, but it's known to create ATP, the body's fuel source. So if the virus is attacking the cell and attacking the mitochondria and shutting down the mitochondrial function, you went from an energetic individual, perhaps a very highly energetic individual, to dragging on the floor. Why does that happen? That's the explanation for it, is the mitochondrial function has been hijacked. Now, methylene blue is, again, a very, 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 very old drug that dates back to the Industrial Revolution, which is why it was developed in the first place as a dye. Methylene blue is a dye. But now it's been used in biology and in pharmacology, and it's one of the reasons why we offer it at Physicians Preference Pharmacy, is it actually can resurrect the mitochondrial function. So it's so selective in working in the mitochondria to give the mitochondria back the enzyme function that it's been lacking because it's been hijacked. Now you get the end product of ATP production that was before lacking. So now you get that improved energy, that improved oxygen delivery that you were lacking when you were just suffering from the symptoms of long haul. Very, very interesting.
The discoveries are just amazing.
Right? And again, we don't have to reinvent the wheel.
Right.
This has been around for a really long time. So we have a lot of experience with it. And methylene blue is definitely having more emerging applications. And it's also being recognized in the health span space because it has these longevity properties. And I would say that a product that is, runner up with it is rapamycin, which
also known as
sirolimus. Yes. So rapamycin is probably the more common word a lot of people are familiar with, but it's sirolimus. They're used interchangeably. Again, you guessed it, very old drug. So, this is something that's been around for a really long time. But the reason that it works in long haul syndrome is it works on something called the mTOR pathway, which, long story short, helps to regulate immunity, regulate inflammation, a lot of other things. But actually, when we take the sirolimus orally just once a week as a capsule, it's so easy. This is probably hands down my favorite compound we make, actually.
Mine too.
Is it provides a lot of energy, but the reason why is it mimics intermittent fasting in the body. And one of the best, if not the best, techniques for getting the spike protein out of the body is achieving something we refer to as cellular autophagy, which is basically taking the trash out. It's the cell's natural way of purging out the trash and the cellular byproducts. That's autophagy. We want autophagy. Autophagy is our friend. But when the cellular function gets shut down by COVID infection, autophagy goes out the window. And then what happens? The cells start killing themselves off, and now we have lesser cells, lesser mitochondria, lesser energy. So the sirolimus helps to preserve that and mimic intermittent fasting in the body and actually help get the spike protein out. So it is thought that by taking ivermectin and sirolimus together, that those actually work synergistically or together better to get the spike protein out of the body. Remember, we have to get it out to heal.
Absolutely. Okay. So those are the key tools that we are utilizing in long haul syndrome. So if a provider was interested in more information, as I always ask at the end of these programs, what would they do?
Please call me. Any of the other pharmacists and myself are waiting to take your call to ask us about how to help your patients with long haul syndrome. But you can reach us at Physicians Preference Pharmacy by phone or on our website. Our phone number is 281-828-9088, and our website is physicianspreferencerx.com. We have so many tools that we've had such great success with in our patients, and we'd love to help yours too.
Thank you. That was such a great education, as always.
Thank you. Physicians Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.